Hello, I'm Dr. Robert Clark. For decades, I've dedicated my life to the health and wellness of our seniors. Today, we need to have a serious talk about a hidden epidemic. Did you know that in the last decade, reported errors with diabetes medications have surged by an almost unbelievable 279%? Even more frightening is this fact. Research suggests that nearly 90% of seniors with diabetes make at least one potentially deadly mistake with their medication. This isn't about blame. It's not about pointing fingers. It's about facing a clear and present danger with knowledge and a plan. You or your loved one might be making one of these mistakes right now, completely unaware of the risk. But the good news, and there is always good news, is that these errors are almost entirely preventable. In our time together today, I'm going to pull back the curtain on the most common and dangerous mistakes I see in my practice. We're not just going to identify them. I'm going to give you the simple, practical tools to build a fortress of safety around your diabetes management. This is about taking back control. This is about peace of mind. Let's begin. Let's start with the medication that is a lifeline for so many, but also one of the most common sources of error: insulin. The mistakes made here are what I call walking a tightrope without a safety net. Let me tell you about a patient of mine, a wonderful gentleman named George. George was in his late 70s, a retired woodworker with hands that had built beautiful things his whole life. He was on two types of insulin: a long-acting one he took every night to keep his baseline blood sugar stable, and a rapid-acting one he took before meals to cover the carbohydrates he ate. One evening, he was distracted. The phone rang, his grandchildren were visiting, and in that moment of chaos, he picked up the wrong insulin pen. He accidentally injected his rapid-acting mealtime dose instead of his long-acting nighttime dose. A few hours later, his wife found him profoundly confused and sweating. His blood sugar had plummeted to a dangerously low level. It was a terrifying ordeal that landed him in the emergency room. George's story is a stark reminder of how a simple mix-up can become a life-threatening event. You're not alone. If you've ever felt overwhelmed by this, have you ever found yourself second-guessing which pen to use, or when exactly to take it? The core of the problem is that different insulins work on different timelines. Think of your long-acting insulin, like Lantus or Basaglar, as the foundation of a house. It's designed to release slowly and steadily over 24 hours, providing a constant, low level of insulin to keep your blood sugar stable between meals and overnight. It's your safety net. Now, think of your rapid-acting insulin, like Novolog or Humalog, as the firefighter. It is designed to rush in and tackle the spike in blood sugar that comes from the food you eat. It works fast, and it's gone in a few hours. When you mix them up, like George did, you're sending in the entire fire brigade when there's no fire, and you're left with no foundation to stand on for the rest of the night. This causes a catastrophic drop in blood sugar, a condition we call severe hypoglycemia, which can lead to seizures, coma, or worse. The science is simple. Insulin acts as a key. It unlocks the doors to your body's cells, allowing sugar, or glucose, to move from your bloodstream into the cells to be used for energy. When you inject too much of the fast-acting key, it throws open all the doors at once, draining the blood of its sugar supply far too quickly. Your brain, which relies almost exclusively on glucose for fuel, starts to starve. That's why the first signs are confusion, shakiness, and irritability. It as a warning shot from your brain that it's in desperate need of fuel. The most practical step you can take today is to create a clear separation system. Use different colored rubber bands on the pens. Store the nighttime insulin on the nightstand and the mealtime insulin in the kitchen. Create a simple, bold-lettered chart and tape it to your refrigerator. Evening, blue pen. Meals, red pen. It seems almost too simple, but it's these simple systems that save lives. Now, let's talk about a medication that millions of people rely on every single day: metformin. It's often the first line of defense prescribed after type 2 diabetes diagnosis, and for good reason. it's incredibly effective. But it also comes with a significant misunderstanding, one that can have devastating consequences if ignored. This is the metformin trap. I'm thinking of a patient, Barbara, a retired librarian who was meticulous about her health in every other way. She took her metformin daily, but for months she had been experiencing persistent digestive issues, nausea, and cramping. She chalked it up to just getting older and didn't mention it to me. At the same time, unknown to her, her kidney function had been gradually declining, a common issue as we age. The problem is, metformin is cleared from the body almost entirely by the kidneys. As her kidneys became less efficient, the medication began to build up in her system, reaching toxic levels. One day she became very ill, weak, lethargic, and breathing rapidly. She was rushed to the hospital and diagnosed with a serious condition called lactic acidosis, a rare but life-threatening complication of metformin toxicity. We were able to help her, but it was a very close call, all because two seemingly separate issues, mild digestive upset and a silent decline in kidney function, were ignored. So, how often do you get your kidney function checked? Do you know what your eGFR, or estimated glomerular filtration rate, is? This isn't just a number on a lab report. It has a critical piece of information for anyone taking metformin. Think of your kidneys as a sophisticated water filtration system for your body. Their job is to filter waste products and excess substances, including medications like metformin, out of your blood and into your urine. When that filtration system starts to clog up or slow down, as can happen with age, high blood pressure, or diabetes itself, it can't remove the medication effectively. Instead of being flushed out, metformin recirculates, its concentration climbing higher and higher. This buildup disrupts the body's delicate chemical balance, leading to the production of excess lactic acid. When that acid builds up, it's like pouring vinegar into your car's engine. It poisons the entire system, and the body begins to shut down. The early warning signs Barbara was experiencing, the gastrointestinal side effects, were her body's way of saying something was wrong. But they are so common that many people just try to power through them. This is why you must never ignore new or worsening side effects. It's a signal. The practical step here is non-negotiable. You must have your kidney function tested at least once a year if you are on metformin, or more frequently if you have known kidney issues. And you must have an open conversation with your doctor about any side effects, no matter how minor they seem. Don't just assume it's a part of getting older. Your body is communicating with you. We just have to learn to listen. Beyond insulin and metformin, there are a host of other hidden dangers lurking in the medicine cabinet. These are the subtle mistakes, the ones that seem harmless on the surface but can quietly sabotage your health. This includes everything from drug interactions to improper storage, and even something as seemingly innocent as splitting a pill to save money. Let me tell you about Frank. Frank had high blood pressure and high cholesterol in addition to his diabetes, a very common combination. He was on several medications. He was a man of routine and started every single morning with a glass of grapefruit juice, believing it was a healthy choice. What he did not know was that grapefruit and its juice contain compounds that can dramatically interfere with how the body processes certain medications, including some statins he was taking for cholesterol. The grapefruit juice was essentially deactivating the enzyme in his liver responsible for breaking down the drug. This caused the medication to build up in his system to dangerously high levels, leading to severe muscle pain and putting him at risk for kidney damage. We only figured it out when he mentioned his morning ritual during a routine checkup. We switched his medication and his symptoms resolved, but it was a powerful lesson in how even healthy foods can interact with our prescriptions. Have you ever considered whether the foods you eat or the other pills you take could be affecting your diabetes medication? It's a question we should all be asking. Our liver contains a family of enzymes called the cytochrome P450 system. You can think of this system as the body's cleanup crew. When you take a medication, this crew gets to work breaking it down so your body can use it and then clear it out. Certain foods, like grapefruit or other medications, can block this cleanup crew. When the crew is blocked, the medication isn't broken down properly and it hangs around in your system for far too long, at a much higher concentration than intended. This is what leads to side effects or toxicity. On the flip side, some substances can speed up the cleanup crew, clearing the medication out too fast before it has a chance to work. Another common mistake I see is improper storage. Many people keep their pills in a bathroom medicine cabinet, but the heat and humidity from a daily shower can degrade medications, making them less effective. The same goes for leaving them on a sunny kitchen windowsill. They need a cool, dry, dark place to maintain their potency. A critical new point I want to emphasize is the danger of pill splitting. Some pills are scored, meaning they have a line down the middle and are designed to be split, but many others, especially extended-release tablets, are not. These pills have a special coating designed to release the medicine slowly over many hours. When you cut one in half, you break that coating, and your body gets the entire 12 or 24-hour dose all at once. For a blood pressure or diabetes medication, that can be catastrophic. The practical step is to conduct a brown bag review. Once a year, put every single thing you take, prescriptions, over-the-counter pills, vitamins, herbal supplements, into a bag and bring it to your doctor or pharmacist. Let a professional look for these hidden interactions and give you clear instructions on how, when, and where to take each one. It's one of the most important things you can do for your safety. Let's move on to the dangerous habits that are born not from a lack of knowledge, but from simple human error and routine. These are the just this once moments that can lead to disaster. The most common of these is accidentally double dosing. We've all had that moment of uncertainty. Did I take my morning pill, or did I just think about taking it? This single question can lead to a dangerous guess. I remember a patient, a lovely woman named Susan, who managed her medications from the bottles the pharmacy gave her. She lived alone and had a busy morning routine. One day, she took her blood sugar medication, then got a phone call that distracted her. A half hour later, unable to remember for sure if she'd taken it, she decided it was safer to take it than to miss it. She took a second dose. An hour later, she felt shaky, weak, and disoriented. Her blood sugar had dropped precipitously. She was fortunate enough to recognize the symptoms of hypoglycemia, drink some juice, and call for help. But for many seniors, a fall or a period of confusion from a double dose can lead to a broken hip, a head injury, or a trip to the emergency room. Think about your own system. How certain are you every single day that you've taken the correct dose and only that dose? The underlying science here is about maintaining equilibrium. Your body, especially when managing diabetes, is in a constant balancing act. The medication dose your doctor prescribes is calculated with incredible precision. It's based on your weight, your kidney and liver function, your diet, and your specific blood sugar patterns. Think of it like the fuel mixture in a car's engine. Too little fuel, and the engine sputters and stalls. Too much fuel, and it floods and shuts down. When you double dose, you are flooding the engine. You're putting far more medication into your system than it can handle, causing a dramatic and rapid drop in blood sugar that your body simply isn't prepared for. Another habit in this category is sharing medication. It often comes from a place of kindness. A husband sees his wife has run out of her metformin and offers her one of his, thinking, "It's the same pill. What's the harm?" The harm is that their doses might be different. Their kidney functions might be different. What is safe for one person can be dangerous for another. Medications are not one-size-fits-all, they are highly personalized. The solution to these dangerous habits is not to try and have a better memory. The solution is to build a system that makes memory irrelevant. The single most effective tool for this is a daily pill organizer, one of those simple plastic boxes with a compartment for each day of the week, maybe even with sections for morning, noon, and night. At the beginning of each week, sit down and fill the organizer for the entire week ahead. Once a pill is in the box, the bottle goes back in the cabinet. This way, you can see at a glance whether you've taken your medication. If the compartment for Tuesday morning is empty, you've taken it. If it's full, you haven't. This simple, inexpensive tool removes the guesswork entirely and is perhaps the most powerful step you can take to prevent double dosing. One of the most tempting and perilous habits I see is the tendency for patients to become their own doctors. This often manifests in two ways: self-adjusting medication doses and experimenting with over-the-counter supplements that promise to help with blood sugar. Both come from a good place, a desire to take control of your health, but they can lead you into very dangerous territory. Let me tell you about David, a retired engineer who was used to solving problems. He diligently tracked his blood sugar, and when he saw it was running a bit high for a few days, he decided to tweak his own medication, increasing the dose just a little bit. What he did not account for was the extra physical activity he had planned for the weekend, a big gardening project. The combination of the increased medication and the strenuous work caused his blood sugar to crash while he was working in the yard. He became so disoriented he couldn't get back into his house. Thankfully, a neighbor saw him and called for help. In another instance, David had started taking a popular herbal supplement he bought online that was advertised as being great for blood sugar balance. He didn't think to mention it to me because it was natural. However, that supplement contained ingredients that amplified the effect of his prescribed diabetes medication, essentially turning his regular dose into an overdose. Do you currently take any vitamins, herbs, or supplements that you haven't discussed with your doctor or pharmacist? It's a critical question because the term natural does not mean safe. The science behind this is complex but crucial to understand. Many herbal supplements can interact with the same liver enzymes we discussed earlier, the cytochrome P450 system. Some herbs, like St. John's wort, can speed up these enzymes, causing your prescription medication to be cleared from your body too quickly, making it less effective. Others, like berberine or ginseng, often marketed for blood sugar, can have their own glucose-lowering effects. When you combine that with a prescription medication that also lowers glucose, you get a synergistic effect. It's like adding 1 + 1 and getting 5. Your blood sugar can drop to dangerously low levels because you're refighting the battle on two fronts without a coordinated plan. Self-adjusting your dose is equally risky. Your doctor doesn't just look at a single day's blood sugar reading. We look at trends over weeks and months. We consider upcoming changes in your diet, exercise, or even stress levels. A temporary spike in blood sugar could be due to a poor night's sleep, the start of a cold, or a particularly stressful day. Making a permanent medication change based on a temporary situation is like trying to navigate a ship by looking at a single wave instead of the tide. The practical action is to embrace a partnership with your healthcare provider. Keep a detailed log of your blood sugar readings, your food intake, and your activity levels. Bring this log to every appointment. This data allows us to make informed, safe adjustments together. Before you take any new supplement, write down its name and ingredients and ask your pharmacist, will this interfere with my current medications? Think of your doctor and pharmacist as the co-pilots on your health journey. You're the pilot, but we need to navigate together. Now, we must turn our attention to what to do when things go wrong. Despite our best efforts, emergencies can happen. Understanding how to recognize and react to them can be the difference between a minor incident and a tragedy. Let's first talk about the most immediate danger for many people with diabetes: hypoglycemia, or low blood sugar. This is when the amount of glucose in your blood drops below a safe level, typically below 70 microliters DL. I will never forget Margaret. Her husband, Tom, brought her to my office after a particularly frightening episode. Margaret had always managed her diabetes well, but one afternoon, Tom found her in the living room, staring blankly at the television. She was pale, her skin was clammy, and when he asked her what was wrong, her answers were nonsensical, and she became uncharacteristically irritable. Tom, having been educated about the signs, didn't argue. He didn't assume she was just tired or in a bad mood. He recognized the silent alarm. He immediately tested her blood sugar. It was 45. He gave her a small glass of orange juice and stayed with her. Within 15 minutes, the color returned to her cheeks, and she was back, as he put it, though she had no memory of the last half hour. Tom's quick action prevented a seizure or loss of consciousness. He saved her from a much more serious outcome. Have you and your loved ones discussed what low blood sugar looks like for you? The symptoms can be different for everyone. For some, it's shakiness and a racing heart. For others, it's intense hunger and sweating. And for many, like Margaret, it presents as confusion, blurred vision, or personality changes. It's crucial that the people you live with know your specific warning signs. The physiology is stark. Your brain consumes about 20% of your body's total glucose supply, yet it has almost no ability to store it. It runs on a minute-to-minute delivery from your bloodstream. When that delivery is cut off, brain cells begin to malfunction almost immediately. This is why the symptoms are often neurological: confusion, slurred speech, poor coordination. Your body also triggers an emergency response, releasing adrenaline. This is what causes the shakiness, sweating, and rapid heartbeat. It's your body screaming for sugar. The immediate action plan for conscious hypoglycemia is the rule of 15. If blood sugar is below 70 microcurries or DL, consume 15 grams of a fast-acting carbohydrate. This is not a cookie or a piece of chocolate fat slows down sugar absorption. You need pure, fast sugar. 4 ounces of juice or regular soda or 3 to 4 glucose tablets are perfect. After consuming it, you wait 15 minutes and then recheck your blood sugar. If it's still low, you repeat the process. In a severe case where someone is unresponsive or having a seizure, you must not put food or liquid in their mouth. This is a 911 emergency, and it's when a glucagon injection kit can be life-saving. This injection stimulates the liver to release its stored glucose, raising blood sugar levels quickly. Every family member of someone on insulin should know where the glucagon kit is and how to use it. Practice with the trainer pen. This isn't just a plan, it's a fire drill for your health. On the other side of the spectrum is hyperglycemia, or high blood sugar. While it may not feel as immediately dramatic as a low, persistently high blood sugar, is a slow-motion emergency that can cause profound damage over time and can escalate into a life-threatening crisis. It's the silent fire that can weaken the foundations of your health. I'm thinking of a patient, Arthur, a stoic man who prided himself on never complaining. Over a hot summer week, he started feeling incredibly thirsty, drinking glass after glass of water but never feeling satisfied. He was also getting up to use the bathroom constantly, day and night. He felt tired and his vision seemed a bit blurry, but he dismissed it all as just dealing with the heat and getting old. He let this go on for several days. By the time his daughter came to visit and saw how unwell he was, his blood sugar was over 400 mg/dl. He was severely dehydrated and on the verge of a dangerous state called hyperosmolar hyperglycemic state, or HHS, a condition with a frighteningly high mortality rate. We had to hospitalize him for several days to slowly and carefully rehydrate him and bring his blood sugar down. His story is a classic example of how the signs of high blood sugar can be subtle and easily dismissed, allowing a dangerous situation to build quietly. What are the signals your body sends when your blood sugar is high? Do you recognize them? The extreme thirst and frequent urination are the 2 most classic signs. Here's the simple science behind it. When there's too much sugar in your bloodstream, your kidneys work overtime to filter it out, but they can only do so much. Once your blood sugar rises above a certain threshold, the sugar starts spilling over into your urine. Sugar is what we call an osmotically active solute. In simple terms, wherever sugar goes, water is pulled along with it. So, as your kidneys dump massive amounts of sugar into your urine, that sugar pulls large volumes of water from your body along for the ride. This is a process called osmotic diuresis. It's what causes the frequent, high-volume urination, and it's what leads to profound dehydration. The extreme thirst is your brain's desperate plea to replace all that lost water. The fatigue and blurred vision happen because your body's cells are starved for energy. The sugar is stuck in the blood and can't get into the cells where it's needed. The action plan for high blood sugar starts with monitoring. If your blood sugar is higher than your target range, the first step is to drink plenty of water to combat dehydration. Avoid any further carbohydrates. If your reading is above 250 to 300 mg/dl, you should also check your urine for ketones if you have type 1 diabetes. Ketones are a sign your body is breaking down fat for fuel because it can't use sugar, and their presence can indicate a slide towards diabetic ketoacidosis, another medical emergency. If your blood sugar remains stubbornly high, especially if you feel unwell, have stomach pain, or are vomiting, you must not wait. Seek immediate medical attention. Don't be an Arthur. Don't try to tough it out. High blood sugar is a clear signal that your body is in distress. Finally, let us talk about the single most powerful tool for preventing all of the mistakes we've discussed: creating a system. Hopes and good intentions are not a safety plan. A structured, consistent system is. This is especially vital for caregivers, the unsung heroes in so many of our lives. A simple checklist can transform care from a stressful, memory-based guessing game into a calm, reliable routine. I saw this firsthand with a patient whose daughter, Linda, was his primary caregiver. Linda was overwhelmed, constantly worried she was forgetting something. Was his foot sore? Did he take his afternoon pill? Was his blood sugar high after breakfast? We worked together to create a simple one-page checklist that she taped to his refrigerator. It had daily and weekly tasks. The daily checklist included boxes to tick for each medication dose spaces, to log blood sugar readings before each meal, a spot to note his food intake, and a reminder to do a quick visual inspection of his feet for any cuts or sores. The weekly review section prompted her to check his medication supplies, look over the blood sugar logs for any concerning patterns, and ensure his emergency kit was fully stocked. Linda told me it was life-changing. It took the mental load off her shoulders and, more importantly, it worked. One week, while reviewing the log, she noticed his fasting blood sugars were creeping up consistently. She called me, we made a small adjustment to his nighttime insulin, and the problem was solved, long before it became a major issue. She also caught a dispensing error from the pharmacy one day while refilling his pill organizer, preventing a potentially serious medication mistake. She wasn't just a caregiver anymore, she was a proactive health manager. This is the power of a system. It creates a safety net that catches human error. Do you or your loved one have a written-down, consistent process for managing diabetes care day to day? An emergency kit is a non-negotiable part of this system. It should contain a week's supply of all medications, a glucose monitor with extra strips, and batteries, glucose tablets for lows, a glucagon kit, and a clear list of emergency contacts and doctor's numbers. The person you care for should also wear a medical ID bracelet. This isn't about being pessimistic, it's about being prepared, responsible, and in control. These mistakes we've talked about today are common, but they don't have to be your story. By understanding the risks of insulin and metformin, avoiding dangerous habits, knowing how to respond to an emergency, and implementing a simple checklist system, you can build a fortress of safety. This knowledge is life-saving. I urge you to share this information with your family, your friends, and anyone you know who is touched by diabetes. Always consult with your healthcare professionals before making any changes to your routine. Thank you for your time and your commitment to your health.